Weak scapular stabilizers and difficulty in terms of scapular control can really impact the discomfort and the pain within the neck area. Hi, my name is Eric, also known as the functional physio. And today I wanted to talk a little bit about the impact on the neck that can take place as a result of weaknesses in terms of these scapular stabilizers. So in a lot of cases, right, with patients who complain about neck discomfort and stiffness and pain, one of the main muscles that patients will tend to complain about is this upper trap region. And again, it's something that we'll see a lot with individuals, for example, that might sit for long periods of time, office workers, where they might develop these positions, right, where they're in these sort of forward head postures, rounded shoulder type positions, and where essentially the muscles that again contribute to scapular control, they might be in a lengthened, weakened type position. So as a result of this lack of control, lack of stability, some of the muscles that might start to be overused or compensate for this, one in particular might be the upper trap muscles, right? So the ones that run along here, run up the back of the neck. And when again we lack this specific control in through the shoulder blade, the upper trap, it's going to have to work overtime, particularly with reaching, lifting type of activities, or again, if we're in these just general kind of kyphotic type positions. And so for a lot of cases, patients will naturally try to lengthen or stretch this muscle because again, they're having this experience, this feeling of tension, when in fact, that muscle might actually be weak and overused as a result of other muscles being weak. And again, this might look like weakness in the mid or the lower trap or the serratus anterior, essentially those muscles that help with our ability to keep those shoulder blades set and in that nice neutral position. So again, you can really have an appreciation then about when we're looking at overall general neck tension, that we really need to examine these different areas of compensation that might be taking place. If you have any questions or concerns, feel free to leave a comment below. And also, I just wanted to make aware that I do have an online course referred to as From Passive to Powerful, where I go into, in a greater, more specific sense, this idea about muscular compensations and weaknesses, and really how this contributes to discomfort and pain in patients. And again, really looking at it from much more of an active approach in terms of the rehab process. Thanks again, and please check with a physiotherapist to make sure that this information is appropriate for you. Have a great day and take care.